Okay, so this will be our part 3 of my report. So I just finished Rorschach. So right now we are in chapter 12, neuropsychological impairment, and then we will tackle later about Bender-2 and RBANS. So for today, we will be discussing the history and development of neurological impairment, as well as the domains of the neuropsychological functioning. And then the main focus of this discussion will be number 1, Bender Visual-Motor Gestalt Test, second edition, and then number 2, Repeatable Battery of the Assessment of Neuropsychological Status Update, or RBANS. So, an important role in our clinical practice is the screening and assessing of possible presence of neuropsychological impairment. So, according to statistics, 20 to 30% of assessment referrals to psychologists has in relation to the CNS, or the central nervous system. Now, neuropsychological assessment as was established way back 1950s by Halstead and Associates in the US. We have Ray in France and Luria in the Soviet Union. During these early beginnings, there were two distinct strategies when it comes to neuropsychological assessment. So one is the comprehensive battery approach pioneered by Halstead and Wright, and then the other one is the more flexible qualitative strategy that was pioneered by Goldstein and Luria. The advantage of battery approach is it assesses both the strengths and weaknesses of a broad spectrum of behavior, as well as it is easy to use in research. Also, it can be administered by trained technicians and can be learned by new practitioners. However, the limitation is it is time consuming. Now, with the second approach, which is the qualitative approach, it has the advantage of addressing the referral question. Aside from that, it emphasizes in the performance of the client rather than on the final score. And then it is also time efficient. However, the weakness of this approach is it is not really good for research. In fact, it wasn't used extensively in research. And then it relies too much on clinical expertise, as well as it provides a narrower perspective about the client's domain of functioning. In neuropsychological functioning, there are 5 domains, mainly attention, language, memory, visuospatial, and executive functioning. Now, in table 12.2, you can see the domains along with the measures that are frequently used to assess them. Attention refers to mental activity which involves filtering, selecting, focusing, shifting, tracking, and sustaining. So one of the measures is the Conners Continuous Performance Test, 3rd edition. So this test is used to assess attention, as well as it reflects the ability to attend, to sustain the attention during a relatively uninteresting task. It also assesses if the client remains vigilant or it has control in his or her impulses. So this is a good measure for concentration and as well as impulsivity. Language is included in the domain because um, disturbance in verbal functioning are frequently associated with brain damage, and particularly in the left hemisphere of the brain. So as a result, when it comes to neuropsychological functions, there needs to be an assessment in the verbal abilities. Another area to check is the academic skills of the client, specifically on areas that measures verbal fluency, um, poor repetition of words or sentences, loss of grammar and syntaxes, and as well as reading difficulties. Another domain is memory that includes sensory memory, short-term memory, rehearsals, long-term memory, recall, recognition, and even forgetting. A good starting place to assess memory is through interview and the specific questions of the interview, such as the basic information like birthday, your address, and then as well as your employment history, your medical history, and so on. Ray Auditory Verbal Learning Test is a frequently used test for memory, and it assesses short-term verbal memory as well as ability to learn new material and the extent to which interference disrupts learning. Visuospatial function is basically the interplay of perceptual, spatial, and motor skills. The fifth domain is executive functioning. So it involves the person's ability to effectively regulate and self-direct behavior. And the functions can be subdivided into planning, purposive action, as well as effective performance. So as you can see in this table, 12.2, you can see the 5 domains and then the corresponding tests that are commonly used to assess these 5 domains. Now, the Bender Visual-Motor Gestalt Test, second edition, is also known as Bender Gestalt or simply Bender, has been used extensively as a screening tool for neuropsychological impairment by assessing the client's visio-constructive abilities. So visio-constructive abilities is simply the interplay of perceptual, spatial, and motor skills in accomplishing specific tasks. So the Bender Gestalt test has an original of 9 designs that were sequentially presented to the examinee. And then the examinee is requested to reproduce them in a 8.5 by 11 inches blank paper. The popularity of this test is due to its ease in administration as well as it is cost effective. And also, it is very flexible and extensively researched. Overall, Bender Gestalt has sound psychometric properties. When it comes to assets, Bender Gestalt is brief and user-friendly. And also, it has norms that cover a wide range of age, as well as it has sensitivity to both developmental delays and acquired cognitive impairment. One of the limitations of Bender Gestalt is it is more of a screening tool than an assessment tool. In fact, it does not provide in-depth information about the specific details and varieties of a particular damage. The administration of these tests has 4 phases. So, namely, copy phase, recall phase, and then the other 2, perception subtest and motor subtest. In the first phase, copy phase, the clients are first requested to draw the designs presented to them one at a time. And then after that, in the recall phase, the clients are asked to draw the designs in a blank sheet of paper and then ask them to copy exactly the designs based on what they can recall in their memory. It's important to note that during these phases, the blank sheet of paper, the 8.5 by 11 inches blank sheet of paper, must be positioned in a vertical form. And also, there must be spare pencils with erasers. Now, after the client completed the first design, the next one should be presented until the entire set of designs has been reproduced. Timing should begin immediately following the presentation of the first design, and then this sequence should be continued at the total time noted after the last drawing has been completed. It is also important to note that no comments or additional instructions should be given to the client. And then, if the client asks specific questions, the reply should be, do the best you can or begin wherever you like. In addition, examinees are not allowed to pick up the cards and that they are not allowed to turn them unless they are in the process of completing their drawings. If the examinee have turned the design and are beginning to copy in a new position, the examiner should straighten the card and state that it should be copied in the original position or angle. So, as many sheets will be available to the examinee, but only one will be presented initially. There is no time limit. However, it is important to note that if there is longer length of time required to complete the test, it might be considered as significant in diagnosis. An observation form is included that enables examiners to note physical and test-taking observations for each of the design, as well as to record the scores of the examinee. During the recall phase, timing must begin during the first drawing and must stop when they have indicated that they cannot recall anymore. And then be sure to label the sheet with recall sheet and then indicate where the top of the page is with an arrow.